So I'm just going to get us started. Folks are going to continue to trickle in. And I'm just going to do a little bit of housekeeping to let folks know where you can find what you need to participate today and what we're going to be talking about. So this is the Stronger Together series. We're doing a series of roundtables about the homeless response system, and we're going to be talking about coordinated entry today. I'm not going to read all of this, but the slides will be available after this webinar. This just gives a brief overview that you just heard in the video of what the Alliance does. We work on policy, we work on practice, and we also produce research and work with the field to ensure that we have the research and evidence to support the work of ending homelessness. And our Capacity Building Center is here to help communities and the field learn best practices, share back what they're doing, and work together across the field to end homelessness. Also, at every Alliance event, we really strive to cultivate an environment that is diverse and respectful. We want people to all get to participate, and that means that we need everyone to treat each other with respect. We do hold everyone to that standard, and we want to make it clear that if you experience any sort of discrimination or abusive behavior, we want to hear from you so that we can address it appropriately. And we just count on y'all to keep the dialogue respectful. On the webinar today, you have access to the chat. I see lots of people introducing yourselves. I love that. Let us know where you're from. Let us know, what you do to end homelessness in your community. There also is the Q&A box. So the chat is for y'all to communicate with each other, have a dialogue with everyone who is participating in the webinar today. The Q&A box will come to me and my team, and that is questions that you would like to see the panelists respond to. So please try to put questions in the Q&A and use the chat for communicating amongst everyone. Also, I know this question always comes up. We are recording the webinar today. It will be available on our website. We will provide the slides after the session also on our website. And there will also be some kind of written documents talking about the content today and giving you a place to start in your conversations locally about coordinated entry. Also, closed captionings are enabled. If you're not seeing them on your screen, you might have to go into your settings to make them visible, but they are available throughout the event today, and they will also be on the video that we post on our website after this webinar. For those of y'all who have not yet attended one of these sessions, we are doing these roundtable sessions monthly. We're talking about each part of a cohesive homelessness response system. We're getting to the halfway point in this series, and today we'll be talking about coordinated entry best practices, centering equity and ensuring effectiveness. You can go back and view the previous webinar and content on our webpage if you've missed any of the previous series, and we invite you to participate in future series each month of this year. The goal of this series was really that we were hearing from folks across the field that with all of the changes recently and a lot of turnover, we really needed some getting back to basics to understand the core elements of an effective homeless response system. And so we put these conversations together to be able to kind of level set our understanding of that across the field, understand the importance and interconnectedness of each intervention that makes up a system, ensuring that we also understand what the evidence shows us and the evidence base for how to do each intervention, recognize the importance of centering equity, justice, and the voices of lived experience in homelessness response, and understanding that we also need creative approaches, especially in light of tight housing markets and rising rents across the country. So why Stronger Together? And I feel like the coordinated entry session is actually kind of a great sum up of the whole reason why we're doing this as a series, is that really we really understand that in order to end homelessness, we have to do it together, right? No one intervention alone can achieve the end goal of ending homelessness. And so we wanted to kind of zoom out, look at a whole system, and really focus on how the pieces play together and are interdependent towards our goals. So at the Alliance, when we are looking at what makes an effective and efficient and equitable homeless response system, it is really a system that is housing people as quickly as possible and preventing homelessness whenever possible, right? And that might be working with upstream systems to prevent homelessness before it happens. It might be diverting people from our system, or it might be rehousing people as quickly as possible, but that the whole focus of the system is around ending homelessness. And that requires us to put housing first and put helping people experiencing homelessness moving into housing as quickly as possible at the center of everything that we're doing. We want to reduce the amount of time that people are spending homeless. Homelessness is a trauma, and the less exposure to that trauma that people have, the better people are going to do and the more resilient they're able to be in the long term. When we're putting together and designing systems and the programs within those systems, we really want to start with that end goal in mind, right? We want to be at the community level making homelessness rare, brief, and a one-time experience. And so we really need to align all the pieces of our system towards those goals. That means not letting people spend a long time in our system experiencing homelessness, making sure that when people do enter our system, we have crisis services available so people are not unsheltered and have a safe place to go, and also ensuring that people aren't just cycling in and out and returning to homelessness after we've supported them in finding housing. And in order to understand how our systems are doing at achieving that end goal, we look at metrics. We look at the data that our system can show us about whether we're getting closer or farther to those goals. So we want to look at, are we reducing inflow into homelessness, right? Are we seeing larger numbers of people becoming homeless for the first time, or are we seeing those numbers get smaller? Are we increasing exits to permanent housing, right, out of our system? Because we can shelter people all day, but until someone has housing, we haven't ended their homelessness. We want to decrease the average length of time people are spending homeless in our system, and we want to decrease returns to homelessness across our system. And these are the topics that we'll be talking about throughout the series. We've already covered street outreach, targeted homelessness prevention, and diversion in our previous webinars. We'll be talking about coordinated entry today. And you can see the rest of the topics. So we hope that that will entice you to come back for future sessions. And when we're looking at all of these separate interventions, we understand that they all need to kind of align around a couple of things in order to work well together. That is housing first, that is data-driven, right? Understanding that the information that tells us how our system is working is an important tool for designing and redesigning like our systems to work better. We have to center equity. We know that our systems are reproducing inequitable outcomes that may start in other systems, but that persist in ours. And we need to get coordinated and aligned as a system. And we'll be talking a lot about that today. So at the Alliance, we like to use the metaphor to talk about an efficient and coordinated system. So if you've ever driven around a roundabout or a traffic circle or a rotary, depending on where in the country you are, it takes everyone kind of moving in the same direction and following the same kind of rules and norms and expectations in order for that roundabout to function. We talk about system flow. We need everyone to kind of be coming in and out of a system in a planned and orderly way. And we want to see a system work like that in terms of the homelessness services system, right? We don't want to see any snags that keep people from being able to get off at their exit and move into housing as quickly as possible. And so we have a lot of interventions in our systems, and they may each individually be great interventions, but sometimes we can get ahead of ourselves and not coordinate them appropriately. And so this is a kind of just a visual image of what can happen when, like, you've got all the different cars, all the different buses, like they're all doing fine, but when they all come together, they're not working together, they're not flowing together. And so it's hard for any of them to move and do what they individually could do on their own. If we align and we plan together and we coordinate together and we're all sort of operating with the same norms and understandings, we can operate a little bit more like a well-planned intersection that allows traffic to flow through and out and get everyone moving along their way. And that is what we hope for our systems. So we're going to talk about coordinated entry today. We're going to talk about best practices, equity, effectiveness, and I'm really excited about the conversation, thinking about how in the latest numbers that came out about homelessness from last year, we're really seeing that inflow and first-time homelessness are increasingly driving the crisis around the country. And we know that coordinating as a system, especially improving how coordinated entry and how people kind of come into our system works, can really be important for meeting this moment where that's where we're seeing a lot of the crisis kind of growing in our communities. Knowing there's no perfect system and that we need to be increasing the equity with which our system is operating. We know also that communities can make progress, and we've got a couple of communities represented here today who are really taking an honest look at what's happening at the ground level on the front lines of their systems and coming up with really creative solutions to address the issues that they see there. So we're going to hear from some really awesome folks about the bold steps that they're taking to address implementation of coordinated entry in their communities. They're seeing their change work pay off. They're seeing reductions in inequities in their systems. They're seeing increased efficiency in their systems. And we hope that their experiences and ideas will inspire you and help your communities to spark some of the creativity you need to tackle whatever your unique needs are. So with that said, I'm going to turn it over to our moderator. Michelle Williams is a Black woman who grew up in the Midwest and believes in using her voice for good. She's a HUD TA provider and implementation expert with over 25 years experience providing services to vulnerable populations, including persons with disabilities, individuals and families experiencing homelessness, low-income communities, populations affected by natural and public health disasters, and in refugee resettlement. Michelle, please take it away.
Thank you so much. So glad to be here with you all today. This is going to be an exciting conversation. Coordinated entry, best practices in centering equity and ensuring effectiveness. Just to frame up, we're really talking about coordinated entry as the tool that helps us in determining what we need overall within our systems, within our communities, a way of advocating for what we need, and gives us the clearest scope or view of the scope and scale of homelessness in our community and the very specific needs and resources that it will take to address those folks experiencing homelessness and end their homelessness in our communities. Coordinated entry is a tool provided to us that's designed to be flexible, right? It's designed to be something that is not going to look exactly the same in every community. So there's components that are definitely required, but the formula and how those work may look different for each community, and you'll hear that in our conversation today. And so every community has to make the adjustments needed in terms of how we enroll people, how we understand what needs are, how we assess those things. We have to do that based upon what is happening in our individual communities. And so just when you think about coordinated entry, I'm encouraging you today to come to this conversation with really an open mind, right? We can all get locked into what we do, but really it's great to learn about how other communities are implementing their coordinated entry processes to really address the equity needs in their communities and ensure that we're effective in our goal to end homelessness. So I'm going to ask each of our panelists to do a little bit of introduction today, just names, any pronouns or identities you'd like to share with us, your role and your location. So if we want to start with Austin.
Good morning or afternoon, depending on where you're tuning in from. Thank you, Michelle. I'm Austin Puka, she, her pronouns. I identify as a Black, Hispanic, Native, white, queer woman with lived experience of homelessness and intimate partner violence. And I am brought to you by way of Tucson, Arizona. I serve as our Continuum of Care's COC manager. Thank you.
Thank you. Sarah?
I'm Sarah Johnson. I'm the executive director of my COC, which is in the northeast quadrant of Louisiana. We are on the opposite end of the state from all the fun part. We're a rural community, and we don't have a large population here. The community of people who work in the field addressing homelessness is small compared to the numbers you would see in other areas, as our number of people who are homeless on a point in time are small. But for us, per capita, it's as much of a problem here as it is anywhere else.
Thank you. Delmar?
Good afternoon, everyone. My name is Delmar Algie, and I go by he, him pronouns. And I come to you from Pierce County, Washington, in particular Tacoma. So yeah, I actually serve as the vice chair of our local Continuum of Care board, as well as a member of a permanent supportive housing advisory board for the state of Washington. And my 9 to 5, I'm actually the one of 2 homeless services supervisors here with Pierce County Human Services. So it's a pleasure to be with so many brilliant minds today, and it's good to see so many folks hop on. So thank you so much for having me.
Thank you. Laura?
Thank you, Michelle. My name is Laura Bass. I use she, her pronouns. I am a white person. I identify as queer. And I am the director of coordinated entry at All Chicago, Making Homelessness History. We are the coordinated entry lead for the City of Chicago, COC.
Great, thank you. All right, we're gonna jump in just by kind of having you all each give us kind of a description about your community's equity journey when it comes to coordinated entry specifically. So is there anyone who'd like to go first, or you want me to just random? Delmar, it looks like you want to go first.
Actually, I was just saying just random, but
well, there we go. Same thing.
I'll definitely go. So, you know, first and foremost, it's been an absolute blessing to work here in Pierce County. We've been extremely progressive along the way when it comes to our coordinated entry and the development of it. So I'll just kind of go back a little bit, back into about 2015 or so, in which coordinated entry became a big thing. And so what happened was we kind of had some different things really progress us along the way. And so one of the big things was back in 2016, we had a group out of Massachusetts called the Center for Social Innovation come and do a research project called the SPARK Report. So SPARK is an acronym that stands for Supporting Partnerships for Anti-Racist Communities. And what they did was they came and they really just broke down our system to just kind of get an understanding of where the holes were and how to improve. And so after this particular report was done in 2020, we had a HUD equity demo that we were part of that said, okay, so, you know, we now know what's going on in your community. We were one of 8 for that SPARK report. And it said, okay, so now let's put some action to what it is that you're doing. And they allowed for us the ability to come together as a community and say, okay, what are we going to do about the concerns that we have? And so therefore, what we did was we put together what are called cultural hubs. And cultural hubs are essentially the front door of the coordinated entry system, and they're making sure that equity takes place there. The way that our coordinated entry system is designed is that we have diversion at the door. And so in different communities, diversion means different things. Here in Pierce County, what it means is it's more of a preventative measure from households going deeper into our homeless system. So it's saying, okay, as an example, you go to that door and you can either turn left or you can either turn right. And turning left means that you're going into a homeless intervention called diversion, in which you have a game plan in which it's going to take you in between 30 to 60 days in order for you to find permanent housing through relocating or reestablishing your rental or doubling up or in shared housing. However, if none of that works for you in this conversation, this 90-minute strengths-based conversation, then you go right, and that is into our homeless system, into the interventions that we're all familiar with, which would be permanent supportive housing, transitional housing, or rapid rehousing. So what we learned was that the door is really, really critical, because you're gathering information as a professional at that door that's going to help determine if someone's going to be referred on the back end or not. And so if the system isn't working the way that it should, then that means that people aren't going to be placed where they need to be. And so what a cultural hub was designed to do was to make sure that there are professionals at that door that look like the population that we serve. And they're there to make sure that folks are being assessed properly, and that's done through having trauma-informed facilities, adding a sense of cultural competency into their service delivery, and then of course also having the skill set in order to usher out the services into the community. And so we developed these cultural hubs and have implemented them into our community, in which they're now a part of our coordinated entry service delivery model. And we're funding them with local dollars. And we've also even added capacity building at the end of it, so that folks have the ability to seek that funding and move forward with the work and have the skills. So just my elevator speech.
That's great. Thank you so much. Sarah, would you like to go next? There we go.
My bad. Our region has a long and problematic history with issues of diversity. So it's something we talk about a great deal here in every aspect of our life. Everything from how money is allocated by the state to who gets access to different resources. It's just imbued into our culture. I feel like it's my job as the continuum manager to really focus on diversity, to get everybody at the table and participating loudly, ongoing, giving input, feeling welcome to do that. If we don't do that, our system is not going to work, or at least that's my perspective about it. Because we've tried focusing as we've gone along on starting with the basic things, looking at the LSA data and disaggregating by race, and then looking at those differences and talking. We have a committee that's a pretty big committee. It meets twice a month, and it's our coordinated entry committee, but it also includes the key people from our service providers and the other entities where they're most likely to encounter people who are street homeless. And that at the beginning of those sessions, we talk about a variety of things, and diversity is often an element of that. Is try to look at is there a difference, a statistical difference in how people are getting access to resources, to housing, what the outcomes are. And we've tried very intentionally to talk among the group. We have unusual demographics in our region. We have almost no Hispanic population. It's like 1% of the total. Our African-American population is about 40% of the total. At the moment, my COC's board is majority Black. That committee is majority Black, and it just worked out that way. But that's good, because we know we've got really good diverse representation on that board, on that committee. And it's something we talk about. All our service providers intentionally survey and talk to their clients as they come through the system to address how they felt. Did they feel like they encountered barriers accessing services? Did they feel like uncomfortable about anything? Did they feel disrespected? And then the COC serves as a sort of backup for that. We invite people, if they have a concern, a complaint, to be vocal about it. When I go out and do presentations and there are clients there, I will ask them specifically, did you feel like you were respected? Did you get the help that you needed? Did you feel like you got pushed away or you didn't get served as fast as you should have? So it's just kind of an ongoing thing with us.
That's great. Thank you so much for that. Austin, would you like to go next?
Sure. So in Tucson, our community's equity journey, similar to Del Mar, right? Coordinated entry, like working really in the initial phases to ensure that it expanded across the geographic region, that as many programs would be utilizing it. So, and that was really important to our continuum of care board. So in our community, like our Hopwa, Ryan White Part B programs utilize coordinated entry, runaway homeless youth programs. It was pretty robust. And I would say probably 2017, 2018, our board really took an intensive look at the data, similar to all communities, to see where disparities and gaps of services really lie, based on like proportionate to the ways that those populations present in the overall census of our county, which while we are a city, we are really spread out. So over 9,000 square miles. And so there are folks that are living essentially rural and in deserts and cannot really access resources. So looking at that data, our COC board took a pretty strong stance in evaluating its own equity across our governance and our leadership, recognizing that, right, you do need to have a representation of the communities that you're trying to serve, and that perspective needs to be at the planning and decision-making table. So it started with really mapping out what our own governance structures looked like, and increasing the ways that we call in folks of lived experience and balance out that representation in implementing policy that states we will compensate folks of lived experience for their expertise, and really outlining how and where their expertise is needed. My colleagues here have spoke around like investment, right? Because you really need to invest if you're trying to improve. So as the continuum of care lead entity, really work to secure resource to put toward that investment. And that involved a really robust evaluation and then a 4-week training with C4 Innovations, and then a further investment for COC funded agencies to have assistance at their agency. Earlier, Del Mar was speaking about trauma-informed facilities. And so recognizing that while our system could be trauma-informed and focus on equity, if the different providers don't have that shared definition and understanding, then it's going to break again. And so, like, how do we move from equitable access to equitable utilization? Because accessing something that you cannot utilize is ridiculous. So yeah, that's really where our journey took us to the same equity cohort, really just trying to get all the information, and establishing a lived experience council so that they could have equitable decision-making with the board as policies and the ways that our coordinated entry system serves folks are redesigned, wanting to ensure that we aren't leaving out that representation and that expertise, and really calling in a diversity of system partners into that discussion, and sharing the continuum's philosophy on lived experience being part of that equitable decision-making, and seeing how we can motivate the other systems to have a shared expectation and implementation in their approach. So we're still on that journey. As we've all mentioned, the system needs to be dynamic and nimble and able to shift as the needs and the environment change. And I mean, unprecedented times have taught all of us that. And as we like shift out of those times, really utilizing what we've learned in these wild times, to remember that we do have the ability to be nimble and to swiftly adjust when we feel like we're reaching roadblocks in our current experience.
Thank you. Laura?
Thanks so much. So in talking about the Chicago Coordinated Entry System Journey to Equity, I'm going to talk a little bit about prioritization and access. So Chicago, in terms of coordinated entry prioritization, is interesting because we never used the VI SPDAT as a prioritization tool. Prior to 2020, our prioritization was primarily based on length of homelessness and chronic homelessness. We did have some vulnerability index tools that we used that were either modified versions of other tools or had been locally developed. But those tools were primarily used as tiebreakers. We were really focused on length of homelessness and chronic homelessness. Early in the pandemic, we pivoted to focusing solely on individuals or households that were considered at high risk of severe complications if they were to contract COVID as our priority, and also kind of shifting to incorporate place-based risk. So starting to have accelerated moving events where we were attempting to house a group of folks either at one encampment or one shelter at the same time, which I think we learned a lot from, and it taught us a lot about kind of how we could think about coordinated entry and housing access differently. However, we're now in 2024 and we are still using that COVID-specific prioritization. And because it is a very broad prioritization, that I think our community is pretty clear that it's time to shift to something else. So we have been working on developing a new prioritization plan for our COC, and we really have been taking quite a while to do this. Our coordinated entry leadership team set up a work group to take on this work. So representation from service providers, people with lived experience, other system partners, funders. This group has been meeting, initially started really taking in a lot of information, meeting with other COCs, looking at our system data. I think finding that while there is a lot of information, like none of this information kind of provides you with a clear arrow pointing you where to go next. And so we shifted last year to really like, how do we take this information and start moving toward decisions? And part of that was really doing a big push to get broad community feedback. So we had a couple of in-person feedback sessions that were about half of the attendees there were people with lived experience or people currently experiencing homelessness. And again, kind of also with a focus on bringing in service providers, but other system partners such as our healthcare system. And we also did a community survey, both online survey, but also had paper versions that were available at service locations. And I think one of the main things that we heard is that what folks were really looking for was increased transparency. That a lot of people did not understand how our system was prioritizing folks for housing, and that people experiencing homelessness didn't know what was going to happen once they were completing an assessment. It just felt like, I just keep updating and I keep updating and no one's telling me, am I ever going to get housing? What is going to happen next? And I think that was really interesting because I think in some of our conversations before about equity, we'd really focused on, I think what Austin talked about, which is like, are we hitting the right populations proportional to how they're presenting amongst people experiencing homelessness? Homelessness in Chicago really severely disproportionately impacts people who are Black or African American. By any measure, it's usually at least 75% of people experiencing homelessness in Chicago. And, you know, when we look and see who we're housing, it looks similar. It looks like we're housing folks kind of proportional to that. When we look at, you know, how we're housing young people or families, again, we're seeing that. And I think we kind of had to make the shift that like, that's a floor. Like, it's great that we're not making things worse, but what is a broader definition of equity? And so I think, you know, one of the things we really have to focus on now is like, how do we achieve better transparency, and really work toward a system where we can give people a reasonable expectation about what is going to happen next. I think another thing we really heard from our community feedback is folks had a lot of concern about what happens to people who are not prioritized. And so I think one of the things we've learned from that is we have to do a better job of kind of pulling in opportunities for diversion or housing problem solving or prevention, and think more broadly about the role of the folks in our community who are doing coordinated entry assessments. So it's a small thing, but we shifted the name. So we used to call them skilled assessors, and we're shifting to housing resource specialist, because the idea is it's not just about doing the assessment, but how do we equip folks with the tools to not just get someone into the coordinated entry system, but also help them evaluate other resources to resolve their housing crisis.
Thank you.
And then I think,
yeah. So go ahead. Go ahead.
Just about access is we also recognize our city is very, there's a lot of geographic discrepancy about what resources are available. So we're also needing to evaluate like where in the city folks have access to the system and where we need to do a better job. Thank you.
Great. Thank you. Just building upon kind of that, what Laura's mentioned about changes that were made in coordinated entry. I'm wondering, Sarah, starting with you, what changes did you have to make in terms of getting people, making sure that there was that representation or changes to your coordinated entry system? If we could start with you, just what were the changes that you had to make as you look to achieve your equity goal?
I think assembling the team was part of it. I wanted to be sure that the people who were at that table having those conversations were representative not only of a particular race, but also a particular geographic region. Here, that matters a lot. We have one very small urban area, and then the rest of it is rural. We have 7,000 square miles, so we're not as big as yours, Austin, but it's extremely rural. So we wanted a real diversity of who was at having that conversation. And we also wanted representatives from the different subpopulation amongst persons who are experiencing homelessness, like domestic violence and people with serious mental illness and veterans and families with children. That's the largest group of people who are experiencing homelessness here, which is families with children and youth. We, as a group, would look at that, and we would look at outcomes as part of that regular twice a month call. We would look at how people were progressing through the system, how long was it taking them, who wasn't moving forward. Data really has been the most effective tool we have had here. All along, any data we could access and pull it, it really, when your outcomes, your actual data is what your team is focusing on, good intentions aren't enough. Then it really helps you focus on getting what changes you have to make to really make a difference. And I guess most of we are actually do use the VSPDOT, and we are in the process of trying to find another tool we really like. But I think we need to do a detailed analysis of how that tool produces different results based on race. I've not found a study like that. I'd be real interested in the results of that.
You're muted, Michelle.
It was going to happen today
It's
at
gotta
one
happen.
point or
Just one.
another, right? So I really appreciate, I think we should all remember that quote, that good intentions aren't enough, right? That we really have to dig deeper and look at what's actually happening. So I'm going to ask Delmar, do you want to weigh in on what changes you all had to make in your coordinated entry system?
Yeah, so much like with Laura in Chicago, we never used the VI SPDAT. We actually had our own prioritization tool that was really kind of we brought community together in order to see what an equitable tool would look like. And so therefore our priority tool was established when we first kind of went into coordinated entry back around 2015 or so. And so changes that came along the way, going back into cultural hubs, the beauty of that particular equity demo, again, we studied that Spark report and said, okay, we've got some disproportionate things going on as far as race and equity. And so the racial equity subcommittee of our Continuum of Care board said, we're going to take this work on. And so what we did is we formulated a group. This particular group consisted of folks with lived experience. We had 2 professors. We had myself, and actually in this particular time, I was a program manager at an agency. And I'll get to that in a moment because I was kind of wearing like 4 different hats at the time. We also had service providers. We had government officials. We had really just a beautiful array of everyone at this particular table in order to say, okay, what is it that we want to do now that we know the task at hand, which is to make our system more equitable. And so we did that. We brought everyone together and we did some qualitative data to just kind of see what people of color experiencing homelessness in our local system, what they had to say about that particular system. And some of the things that they'd mentioned was relationship with case manager, relationship with diversion specialist, how comfortable they're feeling when they come into a particular building. And you know, the evidence was profound that we had to make some particular changes. And so this was our approach to our urban communities, more so like Tacoma, which is more of a bigger city. But we also came up with an approach for rural, which is our Community Homeless Resolution Partnership, or CHIRP. And it's similar to our cultural hubs, except for it's really kind of a volunteer base. And we really cling to folks that aren't funded in order to help us out. And so what CHIRP did was it said, okay, we're going to give you the skills. So say, for instance, you've got really just a business, a for-profit business, or you've got just any place in which folks see homelessness as an issue. So let's just use as an example, like the YMCA. So you see the YMCA, which is the gym in which, you know, maybe they have an hour or 2 in the daytime in which families who are experiencing homelessness can come in and shower. So what we said is, okay, why not use our housing first model of meeting people where they are and literally capturing what they have as a strength in that particular moment. And we said, okay, so just as in the example of the YMCA, why don't we train the staff on how to do these coordinated entry diversion conversations, but only to an extent, with let's say the Brown family as they come in, you know, on a normal Tuesday in order to get assistance. And so with that particular model, what we did was the CHIRP, or the HRP, the Homeless Resolution Partner, they would have that conversation with the Brown family. And if there's a resolution that comes from it that's going to resolve that Brown family's homeless situation, then we provided temporary financial assistance in order to get them into housing. So that was that approach. Cultural hubs were a little bit more in depth because they're actually funded rather than on the volunteer basis. And so my particular role was really cool because I was a consultant on the back end for the 2 agencies that really did the work to kind of jump off cultural hubs. And then I moved into my position of being a funder. So I got to oversee the team that was putting the dollars to it. And then we also put money into capacity building to make sure that the cultural hubs actually have the ability to, on the back end, successfully get funding to move the work forward. So it's been just a very, very cool thing. We're really kind of at the end of our first pilot of it. And so we're starting to finally see some results and to see the good that it's done in our community. So now we're just kind of moving all of that forward, hopefully with an equity lens, and making sure that our folks experiencing homelessness on our streets of Pierce County understand that they have options to go to in order to get services. So that's the biggest change in our coordinated entry system.
Great. Thank you so much for that. Lots of conversation. You mentioned a tool. I just need you all know anytime you mention a tool, everybody wants it. So there's already lots of conversation about, can you send that? So definitely you'll want to take a look at those. Austin, can you talk to us a little bit about changes you all had to make, and particularly focused on your inclusion of people with lived experience that you mentioned previously, but just expanding on that a little bit.
Yeah, Michelle. So changes for us, we recognize that while we are regulatory required to utilize a coordinated entry system, they aren't normally robustly funded to do that. So the continuum of care lead entity and administers a supportive services only coordinated entry grant to put some resource behind that. And that was one of the first changes, and to be really specific around who those subrecipients would be, to the point of equity and how are we best meeting the needs of the different folks in our community. So those providers range from our intimate partner violence and victim service provider that really helps us make our emergency transfer plan work, to a family youth provider, an agency that has a history of really working with justice involved folks in reentry populations, veteran, and then a shelter provider, knowing that all of those providers are going to really see different folks coming into our system. And then that data, to the point of my colleagues, helps us to continue to refine. We are a community that was utilizing the VI SPDAT, and we know that that is not an equitable tool, hence or pulling that. And similar to what Laura mentioned around really taking our time, we participate in that equity cohort. And locally, I think we left thinking we were going to get the perfect recipe and we were going to have this beautiful assessment. And we were just going to start using it. And, we had to do some further learning. So qualitative data, right? We are a community that also heavily relies on data, and quantitative data can only get you so far. You need something to tell that story. And so our university partner was really a key in that, in implementing various focus groups that really gave space for the folks to come give their input, and from without someone that traditionally serves them, so that they had space to be as candid as they really needed to. And that university partner also established a lived experience council at the university level, so that ongoing through our continuous quality improvement, when they do evaluation, we know that the equity piece in our board and governance expectation that folks that lived experience will be throughout that journey. Our tool itself, as we start to redesign that, and we're still in the last parts of our testing of our new tools, but really we leveraged data. We were an ERAP community, and so we pulled that data to see who are we serving, and then really looking. All my colleagues have been speaking about outcomes, and so right, Laura mentioned that Chicago really does serve proportionately, and we wanted to see, but what about when folks are exited, from programs? So if we were proportionally serving you, but disproportionately exiting you, what's that about? So really looking at outcomes to say, where did that break? And so we established a work group when we were ready to kind of kick it in gear, because we felt like it was the time and duration and the need of the community was weighing on that work group. And so their priority areas really centered race equity in client choice. We recognized that often when we see data around referrals being denied or folks being exited, like our qualitative feedback let us know, are we really evaluating why? And is there a way to proactively respond to that so that you aren't, right? When HUD says that you're not supposed to be traumatizing the individual or the community. So how can we proactively prevent that? So our tools now have moved from, we don't, when we think of VI SPEDAT, you have the TAY or the transition age youth, family and individuals. In our community, the data took away the need for a specific youth one. Our COVID tool, similar to Chicago's, really called in health disparities and experiences related to that. And our victim service provider and that data that we evaluated on fatalities kind of helped us refine questions around experiences of violence and vulnerability. So that's just embedded throughout the family and individual tool, to the point of, skilled assessors and that housing piece. It is also pretty challenging to become really skilled across 7 different assessment tools. So really trying to narrow that down. And it's really challenging for the person experiencing that tool, if it's 12 pages long. So how are we condensing that information into information that is pertinent to housing someone? And recognizing where information that we previously collected is at the role of the provider once you are in your house, right? We think of assessment is for prioritization into housing. And then, as a community, yes, we need to know how are we having case management, expectations and best practices once you are in housing. And most currently, really working to better understand we have flexible funding that we are utilizing to implement diversion and homelessness prevention, and really trying to focus our understanding of the difference between eviction prevention and homelessness prevention, and the ways that coordinated entry system isn't easily utilizable. That's not a word, but it's going to be now, for HUD or ESG homelessness prevention dollars because of the regulatory restrictions around how a participant could access those funds. And so trying to use our philanthropic dollars is an opportunity to really look into how can we better understand how we efficiently serve folks and take that efficiency and that data to try to let the folks know. And most currently, a new tool has been designed that is implemented by outreach and navigation in encampments to assess folks in that way. Previously, engagement was happening there, and then folks have to connect with an access point. And when we think about someone's willingness and engagement in the rapport building to be able to connect to services, it's really critical and crucial that it happen at that time. And so that tool has really enabled a great wealth of knowledge to be gathered on the need for learning at the provider level that's implementing it, and some refinement to our general tools that we will continue to use. And we are also a Fuse community, so we're trying to refine how we're going to utilize the data to effectively use our CES to support frequent utilizers.
Yeah, thank you. I just want to highlight that, in what we've heard from the panel today, right? HUD requires you to use a tool. It doesn't specify what tool, right? And there's certainly ways where some tools that exist that have been used meet the needs of communities, and that's fine. But I just want to really highlight the practice of figuring out what's right for your community, and what Austin identified in terms of look, what are the actual issues that impact people in our community, and what are the other systems, right? And really looking at that data, comprehensively to to develop the kind of questions or assessment process and tool that's needed for your community. Laura, can you tell us a little bit about Chicago's not using, you're using your own assessment, the COVID assessment impacted what you're doing. How do you deal with like best practices around that? In terms of identifying what type of housing a person needs, and dealing with the vulnerability within that leads to prioritization.
Yeah, what we are doing right now is we are focusing on people who are prioritized and matching them to the housing that is first available. So it means that sometimes folks are going into rapid rehousing who may be eligible for permanent supportive housing and may ultimately need that. We have a pretty robust transfer process for folks that need to transfer from rapid rehousing to PSH, or to maybe from PSH to a different type of PSH. It is not easy. It is really time intensive. And we ultimately do not have enough permanent supportive housing, I'm sure, similar to everyone else. So it is a challenge, but I think the goal is, again, really been to, our system is large and it's complicated. And the goal has been to get folks into permanent housing as quickly as possible. And then if ultimately the housing they're placed in is not going to meet their needs, how do we then facilitate a transfer as smoothly as possible? And then we're very much in the middle of building a new prioritization. And so I think thinking about what are the factors that our community thinks are important in terms of measuring vulnerability. And then I think linking in what Austin said to ensure that the tool is not so long, that it is traumatizing or onerous for either the person participating or the person administering it. And then that it's getting us to a point where at some point in the future, we can, to some degree, predict for folks if they're likely to be prioritized for housing through the COC or not. So that we can tell people if the reality is they're not going to get a COC resource, how can we then help, shift gears and work on other options?
That's great. Thank you. Delmar, can you weigh in on kind of the same thing, since you all are not using, we're not using the VI SPDAT? Yeah.
So I did just kind of peek in the chat, and I saw that a lot of folks are asking for kind of the prioritization tool, and I'm more than happy to send it out. However, I understand that this is a recording, so perhaps folks can go back in. And I also wanted to mention, of course, that the research needs to be done in each and every community in order to make sure that you are serving the best to the best of your ability. However, I was able to pull up the actual research that was done in order for us to usher in this particular tool in our community back in 2015. So I'll share really quickly with everyone that rather than going into the VI SPDAT, which of course gets into some things that we deemed weren't necessary in order for someone to seek housing, we had 15 questions. And so those particular questions are as followed. Where are you currently staying? On how many separate occasions in the last 3 years have you lived in a place not meant for human habitation, shelter, or motel? How long have you been homeless this time? When was the last time you or any adult household member had a lease in your name? How many times has any adult household member had an eviction in the last 5 years? Your household size, household member age groups. Are you pregnant? Do you have now, or has a healthcare provider ever told you that you have any of the following disabling conditions? And then that lists alcohol abuse, drug abuse, chronic health conditions, disability, developmental disabilities, HIV/AIDS, mental health problems, or a physical disability. 10, do you need assistance with activities of daily living and or access to life-sustaining medications, treatments, or equipment? 11, how many times have you used crisis services, mental health triage, crisis bed, suicide prevention hotline, detox, and or have you been hospitalized in the past year? Number 12, considering all sources of income, what is your household's total monthly income? 13, do you currently have U.S. citizenship or legal immigration status? And that is because of a housing authority question. 14, how many times in the past 5 years has someone in your household been arrested or picked up by police? And then the last question is, has anyone in your household ever been convicted of any of the following offenses? And that was a list of felonies such as sex offender, arson, and again, that was also a Tacoma Housing Authority question. So I wanted for folks to be able to capture the questions because that goes back to the diversion at the door. Let's say I'm a Black man, which I am, and I go into a predominantly white agency and I'm homeless and I need help. And that particular case manager sits down and may have the best intention in the world, but they ask me those questions. What am I going to tell them? I'm going to tell them what I think they want to hear. And so in telling them what I think they want to hear, I'm not going to be properly assessed. And so therefore, it's extremely important to have someone, to have options, to have someone go over this prioritization skill, or excuse me, tool with them that they're comfortable with so that they can be properly assessed in the system that we have in place. So that's kind of what our thinking was in not just implementing this particular prioritization tool, but on the front end of it all, having someone that looks like the population that's in need to be able to serve them.
Thank you. I appreciate that because I think you're highlighting a number of things that are really great. But the last one in particular is that representation matters, right? It matters because our society, right, and how people interact with institutions, of which we are one, is a lot based upon what I think I need to do or say to get this particular outcome. And we all do this throughout our lives. This is not exclusive to people experiencing homelessness or any other activity. This is something that human beings do. And so really important to highlight that people need to have a way of feeling comfortable to be able to share what is the most sensitive information in their lives, right? And if we think about if we had to sit down across from someone who we have nothing in common with, right? We have no connection, right? And disclose these very intimate details, right? We wouldn't do it, right? We'd walk away. We would, answer everything so positively. And just in my work, research has shown that in particular for Black African-American populations, there's a real still need to identify ourselves as being worthy, right? And so deserving, right? And so if you're a community that's still using that type of language, understand that that's based in, the systemic oppression that has existed within our society in America. And that should not be the basis for how we assist someone in ending their homelessness, right? So appreciate you highlighting that particular piece. I do want to ask you all, and Sarah, I want to start with you in terms of a lot of times communities think that we can't take any more people into coordinated entry because we don't have a resource, right? And so I wanted to have you all talk about continuing to do those kind of coordinated entry intakes, even when a resource may not exist as you know it right then.
We don't delay those. If we don't have the people who are homeless in a list that we are all looking at and working on together, somebody's going to fall through the cracks. I know that that's been a conversation that we've had a lot in the state because some communities, some regions in our state have far less than others, and that's more just a matter of the population in some of those communities, or maybe the area was hit really hard by a natural disaster, and that took away a big bunch of their affordable housing. But our policies and my consistent carping on it is that nobody just gets stuck. Nobody just calls in and then just falls through the cracks. They get anybody who fits our criteria, and that is they are literally homeless, one of HUD's definitions, or they meet category 1 or 2 in the homeless definitions, or they're close to it. They get a screening. And when I do monitoring, we have a call-in list people can the programs have a call-in list, and I can look at that call-in list and see, I'd take a random sample and say, how come that guy didn't get on there? So it's something I pay a lot of attention to and am really, really, really focused on. I mean, if one of the programs does not consistently put people on the list when they're supposed to be on the list, then they get monitoring findings, and that impacts their score in the competition. So anytime you influence somebody's score in the competition, you really get their attention, and it's something that they really focus on.
Thank you. Austin,
Yeah.
you all, yeah.
We continue to assess folks when there's not an available slot or identified program. And really, that's the only way our community is going to have data on what's missing so that we can continue to advocate for greater funding in the areas that we need it. And we implement case conferencing. Right now, we have chronic case conferencing that we do. We do one for our encampments, and then we do veterans case conferencing. And we've done a considerable, we kind of grew this in the pandemic, but really calling on partners that have other resources that could house folks to participate in those case conferencing, recognizing that HUD and COC funded housing is not the only housing in the community. Mm-hmm. And so how do we activate all of the available resource to all work towards the goal of ending and preventing homelessness? And that includes really calling in system partners and folks that, systems that have perpetuated some of the harm that has led to homelessness and generational poverty for many folks in our communities. And so one of those partners that we've really increased their understanding and their engagement with our system is our justice system. And so they now have justice navigators that are trained in HMIS, with the continuum, and our coordinated entry lead supported in providing all of our judges training on coordinated entry and housing programs so that they could understand the difference between termination and eviction and how they can actually support the housing system and prevent evictions and probably foster mutual terminations between property owners and how they can support when there are folks that are, we know that 90 days, right? If you're an institution, you're going to lose your housing or ability to qualify or be eligible, is the better word for that. And so giving that education to them, to the point earlier that Laura made of transparency across our community, not just with the folks that are going to be assessed and are needing resource, but the folks that impact their success and ability to enter a program. And I never forget our justice provider asking me, what can y'all do to house folks? And I said, well, first I need you to go correct the messaging you have done around housing folks after they have exited the justice system. Right? And so they went on a road show with me to help. How do we repair that? Right. And so currently we are, we're still assessing folks and we're bringing in other partners and trying to, as cross systems, hold each other accountable and to ask our community, where have we historically not held ourselves accountable and how do we correct that?
Thank you. Laura, can you tell us how you all are handling that?
Absolutely. So we assess many more people each month than we have the resources in the COC to house. And we just implemented some changes to our assessment process and training. So previously we were instructing assessors to screen out anyone who did not meet Category 1 or Category 4. We have updated that. So we are having folks who are at risk or doubled up have the opportunity to complete the assessment for a couple of reasons. One is sometimes it's the same person who is experiencing literal homelessness just at a different point in time. But also we do have some partners that it's not a huge number, but we have some housing programs that are able to house folks who are at risk or doubled up. And we want to invite them to use coordinated entry instead of setting up another wait list that folks have to get on. So again, I think we just really want, to the extent possible, to kind of be flexible and be a place where folks can get connected to a variety of housing resources or supports. And we also recognize that we're assessing a lot of people, and there are people in our system that have a hard time accessing the assessment. So another change we implemented is to start collecting from folks, if they're willing to share at the time of assessment, the zip code where they spent the previous night and the zip code where they are from, just to try to get a sense of like where in our city folks have access to the assessment and if there are any gaps. Early in the pandemic, we started heavily depending on our coordinated entry call center to do the majority of the assessments, because some of our access points were in healthcare centers. They were, they had to close to walk-ins for the assessment. But again, now in 2024, we've really kind of overwhelmed the capacity of that call center. And so we're really trying to focus to getting more folks out in the community who are able to complete that assessment. As others have said, like in the places where people are already spending time. And so looking at like, what are the regions of the city where we need to have a new access point, or we also have a mobile assessment team. So looking for partnerships where they can, partner with a behavioral health clinic or partner with an existing drop-in center and kind of have a regular schedule where they can be in some of those underserved areas of the city.
Great. Yeah, I really want to emphasize here that like there's if you don't enter people into your system, then CES can't be used as an effective tool for understanding your system needs, right? If I only enter people for the resources I have available, right, then I don't know what the rest of the system needs. And I think it's really important, as you highlighted, that you have to look at where people are, where are they accessing services now, and how are we collecting with them, and how do we get information on what their needs are so that we have a better informed kind of body of data for decision making and advocacy for funding and everything else. I want to move us to really kind of our last question before we see if we have time for any other Q&A questions. And Delmar and Laura is actually making a great transition to this, right? So now one of the biggest strains on all of our systems is inflow, right? We know that we have more people coming in than we can exit in a lot of cases. And so how have you had to adapt your coordinated entry processes to deal with this kind of increased level of inflow?
Yeah, inflow is a hot topic around here. We actually just recently have a local, what's called our comprehensive plan to end homelessness, and we actually talk about inflow quite a bit. It's one of those things that's really kind of difficult because we don't have as many resources on the back end. So what we try to do is we try our very best to have that creative conversation up front to see what strengths are available in order to hopefully divert that particular household from our system. That's really what our main goal is right now, because I was just working with our team this morning about, we were putting together our budget for our biggest NOFA that we put out each and every year. And the ask was 37 million bucks from providers. However, we've got about 15 to spend. And so you just simply, and I'm sure that there are other COCs on this call that probably have similar situations. So the inflow is definitely an issue. And the best solution that we've kind of come up with is the hope that we can divert folks from that particular highly taxed system. And of course, on the back end, we're also doing some different things locally, like we just passed a 0.1% affordable housing tax. We also have a behavioral health tax that can feed into our homeless system. So we have different funding flows and funding sources. We've got some state dollars, we've got some local dollars that are there, trying to kind of right size the issue. But as far as right now, when it comes to the inflow, a highly successful tool that we've done is just to kind of revamp our coordinated entry and make sure that we're getting folks into permanent housing that way. As I mentioned earlier, when someone enters that door, it's almost like you go to the left or you go to the right. And it's our goal to hopefully bring as many people to the left as possible and saying, okay, so you've come up with the creative solution to your homeless situation in which you feel as though 30 to 60 days from now, you'll be in permanent housing with one-time assistance. So that's really what our main focus is right now, and just kind of expanding on what we've done and just being innovative along the way.
Thank you. Sarah, Austin, do you want to weigh in on how you guys are handling inflow?
Yeah, I don't
We,
have, oh, go for it,
you go
Sarah.
ahead.
Okay, I don't have much more to add than my colleagues before me were doing something similar. The only thing I would add is that we are really trying to take a more in-depth look at how we are activating our move on policy across our continuum and our public housing authority, recognizing that we have it. And historically, it's kind of almost been working on accident. And so really trying to look at where folks in PSH programs aren't necessarily utilizing the supportive service piece, and are they ready then to move on into available vouchers so that we can create movement throughout the system. Because I perceive that we don't have a fully accurate idea of inflow because we don't have an understanding of flow. And so I think that inflow may be positively impacted once we get our minds wrapped around and our processes around flow throughout the system.
Thank you. Sarah?
We use the inflow as a tool to negotiate with other housing sources we don't think of the coordinated entry as just an entry into the HUD funded housing sources, but as a door to get into any solution for housing. We have some TBRA in some of our areas, and we were able to use the length of the list to negotiate and get one of our larger housing authorities to give priority to people who were homeless. And we're continuing to use that to negotiate with the others to reach out to affordable housing providers. It gives you a tool to look for, if you open up yourself to the various housing options that are available. Here, churches are a big social system, so we can look, to connect with churches to work with them to get people into housing. We try not to limit ourselves to just the HUD funded programs, because if we did, we would have a list, a super long list, but we look for any option we can have and use that list to negotiate with people.
Yeah, thinking about the other types of solutions, right? I think we tend to think of coordinated entry only for like kind of one solution, but in fact, in our communities, it can be that doorway to lots of other things, and including resources and tools that we have in terms of housing problem solving and prevention and diversion and rapid exit, like all of those things, but also as a mechanism for other systems, right, who may have housing or other opportunities that we can bring everyone together and have a more fuller kind of portfolio for addressing what's happening, and a way of understanding the gaps, right? So that exist, right? That continue to exist in terms of our service networks within our communities. So just one last question that we have time for, just one last kind of question before we have to get to our wrap up. And I wanted to ask you all if there's one thing that you would encourage communities who are really looking to improve equity and effectiveness in their system. Is there one thing that you would tell them to do? And Delmar, do you want to start it off? Or I saw you nod a lot. So
yeah, sure. Data doesn't lie is the thing. Really just allowing for data to kind of be the roadmap to where you need to go. Honestly, just again, going back to the Spark report, it was eye-opening. That particular report ended up in our local newspaper and things like that. It's like, wow, this is what's going on in our homeless system. So allow for data to be your North Star, but then to always have action steps with whatever it is your community is looking for and demanding of your system. really don't be afraid to jump in and be creative and innovative and figure it out. So that's my 2 cents to the folks on the call today.
Okay, Laura?
I would say to welcome criticism. It is not easy, and I think it's easy to jump into defensiveness or saying, well, we can't do this because XYZ. But I think anyone in your community, if they're criticizing your system, if they're pointing out the flaws in your system, it's so important to be open to that and to hear that, and to not immediately jump to defending the system as it exists, but to think about, why is this a problem? What could we do differently?
Great, thank you. Austin?
I would say do not prioritize process over people, and to really, right, like no solution about us without us, to ask the folks that you are trying to serve what they need and build a system around their qualitative responses in that data.
Thank you. And Sarah, you have the last word on this.
Be sure that all the voices of the groups and people impacted are at the table, that it's not just a few people making decisions about a broad section of demographics and subpopulations and geographic areas. You really have to reach out and get all those voices to the table and be persistent about it to be sure they keep showing up.
Thank you. We appreciate you all taking the time to spend with us today, right? This is always a great conversation to have with folks from across the country who are all working. We're all in the same fight, right? We're all trying to end homelessness everywhere we can. So I'm going to turn it back over to Dee to wrap us up.
Thank you so much. And that was truly such an enlightening discussion. I learned so much. Thank you all so much for agreeing to be here and share what your communities have learned. I'm going to do a quick wrap up, kind of sum up some of what we were talking about. So one of the big messages that I'm hoping folks are leaving today's conversation with is really how much of a tool coordinated entry can be for every system to really take stock and get kind of that bird's eye view of what is going on across the entire system and how powerful a tool that is for advocating for what you need to end homelessness in your community. It's in some ways like we're at the halfway point of this whole Stronger Together series. And I really feel like coordinated entry is like, this is where the rubber meets the road on working together as a system. So that to me is an incredibly powerful message, and one that I've learned so much about from each of your communities and many other communities around the country. And then I want to kind of point to a few things that have kind of emerged as I got to speak with each of the panelists as I was helping put this together. That are more about the process of kind of changing and iterating on the systems that we already have, but that we know we want to make them better and make them work more equitably. That these are some things that bubbled up to the top. They're not the only things, but there are some things that I think may help communities who are like in this process and are trying to figure it out and are hitting roadblocks. To continue in that change work and to stay the course. So the very first thing, can't say it enough, is really to meaningfully engage people with lived experience in your community of your system, right? People who are going through your coordinated entry processes are the best people to tell you how those processes are working or not working. Also a big message for communities, especially communities that don't have a ton of staff in the COC or where everyone is really burnt out. We know this is really hard work. Start small, right? You do want to take stock of your whole system, think about the big picture, but you can take small steps that can have a really meaningful impact. And from there, building on successes and learning from failures. Not everything we try is going to work, but we've got to try things because we know that if we just keep doing the same thing, we're going to get the same results. So if we want to see change and and see more equitable outcomes in our systems. We do have to try new things, and that can be scary. But we have to welcome failure as a place to learn from. And then when we do have successes, like shout those from the rooftops. That brings more people into the fold. That kind of brings me to the next one, which is build a bigger table. We had a lot of questions in the Q&A about like, what about all these other system partners, right? We want to hear from schools and healthcare providers and all these other places people are showing up. We absolutely need those folks to be partners in ending homelessness in our communities. And coordinated entry is a tool for building a bigger table to do that. And coming into conversation with people across systems that we may not have engaged before. Also really want to emphasize building out knowledge and capacity, right? We have to treat all the parts of coordinated entry and all the parts of our system as skilled work. If we're gonna have a new assessment process, we need everyone to be on the same page about that. And so we do need to help bring people along and make sure they have the tools and the skills to support that across the system. Relationships are everything, whether you're in a massive urban area or whether you're in a spread out rural COC, right? We have to work together, and our system is only as strong as the relationships that we have with the programs and the people in our system. This is not work that comes to an endpoint. We have to keep the conversation going, and we have to understand what's going on. We have to look at our data, and that data is, yes, the numbers and outcomes that our system are producing, but also the stories, that qualitative data and information that only people in our system can tell us about. So I want to thank you all so much to the presenters today. We will be sharing these slides with contact. So if you have specific questions about what you heard from people and want to know more about their community's practices, please do reach out. If you have questions about the series, please reach out to my colleague, Josh. His email address is here, and please do join us for the rest of the roundtable series. We appreciate your time. We hope this is inspiring you and providing some helpful information for moving forward. And thank you all so much for attending. That is a wrap.